All right, in your Health Watch this morning with us once again, Dr. Syed Hussain from Trinity Health of New England. And usually we're talking about COVID, but we're going to start by talking about the latest with monkeypox concerns. There's been a big change with regards to vaccinations due to a short supply. It looks like the government has found a way to stretch that supply. Please tell us about it.
Sure. Morning. Thank you for having me. So the FDA yesterday issued an emergency use authorization. Again, this is a tool that can be used in a public health emergency, which the FDA successfully used multiple times during the current COVID-19 pandemic, whereby, because the demand is so high, Tim, and the supply is very limited, we want to make sure that this monkeypox virus, which is spreading pretty rapidly, we're able to tamp down the spread.
Yep.
And because of that, this new EUA basically authorizes healthcare providers to give 5 doses out of the 1 dose for monkeypox vaccine.
All right. So I think the two main questions people have with this is the 1/5 size dose just as good as the big dose? And if so, why didn't they do that earlier?
So this is, again, being used as a tool during a public health emergency. It's based off of a study done in 2015, which indicated a lower dose given in a different manner, so it's just below the skin as opposed to more deeper, will actually have the same immune response as a full dose.
Okay. So, all right, that's at least some good news and something to buy us time until we can get the next million or so doses that the United States has ordered. We want to talk about polio. There was a case of polio in New York recently, and I can't say I'm all that surprised because even before COVID, we started to see vaccine hesitancy leading to rises in cases of measles. Now there's at least one case of polio. What do we need to know about that? Should we be concerned?
Sure. So no need to be concerned. There's no need for panic, but it's important viewers are informed and they know what polio is.
Yeah.
It's a virus that can cause, in a very small subset of patients, pretty disabling and debilitating set of symptoms related to the spinal cord and brain.
Yeah.
Now, the individual who did test positive for polio in New York was unvaccinated. This is the first case in over a decade in the U.S. And in fact, we haven't had any cases of polio originate in the U.S. since 1979, which all point to the fact that we've had a very safe and effective campaign of vaccination, which has really worked. There is no cure for polio, but we know there are very effective vaccines that can prevent the spread.
A lot of vaccine proponents have always said there are certain diseases that if they came back into the fold would remind people, oh, yeah, this is the reason why we have these vaccination campaigns. I get the sense polio is one of them because the world collectively celebrated in a way that would seem weird given common sentiment now once that polio vaccine was discovered and developed.
Absolutely. Very effective vaccine. So for viewers to note is if you think you have not been vaccinated against polio, right now it's part of the childhood immunization schedule under the age of 6. So, but then you need to reach out to your primary care doctor to have a discussion. The other disease that comes to mind where vaccines have been extremely effective is smallpox.
Smallpox too, yes. Let's talk while we have a little bit of time. I know we talked about it last week. These rebound cases of Paxlovid, COVID rebound cases after taking the antiviral. Is it in some cases worth it to risk lingering symptoms for some people?
Yeah, so Paxlovid rebound is seen in a very small number of patients, Tim. It's been in the news because of some really high-profile cases.
Correct.
We've seen the president, Dr. Fauci, for instance. But viewers need to keep in mind that it's a very small number of patients that can develop a recurrence of COVID-19 symptoms after they've completed treatment with Paxlovid. And usually those symptoms are mild. Sometimes they may be asymptomatic with a positive test. Bottom line here is you need to isolate for 5 additional days, which is a little cumbersome because you're just coming out of COVID. And you need to wear a mask for 10 days.
I'm guessing if the people had not taken Paxlovid, they probably would not have still been testing positive for COVID at that point. But if that's true, would that only been because Paxlovid had dampened the amount of virus in the body and then only to see it sort of rebound later? You know what I mean?
Yes and no, because if you look at the study that was done by Pfizer, there was a percentage of patients who on placebo still developed a recurrence of symptoms. Some of this may be due to the fact that we're dealing with more subvariants that are more contagious and are able to evade in some shape or form immunity. But at the end of the day, what folks need to remember is Paxlovid is really very effective in terms of preventing severe outcomes.
Correct. You never want to look at these things in a binary way. It either works all the time or works none of the time. That's not how real life is. Paxlovid still looks to be quite effective. All right. Thank you so much, Doctor.
Thank you.
Good to see you.
Thank you.
We will be seeing you on Wednesday mornings going forward. So we are excited for that. Who we see every day, Rachel Piscatelli. There's always weather to talk about, isn't there?